Hello everybody, Nurse Scott here. How are you? For vlog number 2, I wanted to get things going. I'm still preparing for nurse practitioner school, which doesn't start for a few months. I'm a little crazy, so I'm buying things and setting up my desk and everything like that. Um, and in the meanwhile, I thought, well, let's do something in the vlog here, in the vlogosphere. And so I decided let's do a Q&A, an Ask Me Anything, a Q&A. The only problem is, as of right now, I don't have a following to ask me questions, so I decided to look at some other nurses on YouTube and see what questions they're answering in their Ask Me Anythings, and also really use some of the questions that I get all the time as a nurse, and I have for a long time. So for what it's worth, here's what I think about all kinds of things. Let's start. I do have a cheat sheet. Hang on one second. Let me click a few things. Here we go. So let's see. So what are the best and worst things about being a nurse? Well, like anything, there are pros and cons. And I guess the worst would be, well, aside from being on your feet all day, abusive patients. um, that it just has never ceased to amaze me that people will come to us for help and then abuse us and yell at us and argue with us. Of course, I was in the emergency department, and a lot of it happened in triage, people who were waiting to get into the ER. And my job was to sort them out and see who was the sickest and what kind of room I had available and interview the patients and take their vital signs. And at a busy emergency department, there's a long wait, and some people got frustrated, and I understand that. And they can say, why haven't I gotten back? I've been here for 20 minutes. It's like, you don't realize the wait is at least an hour, so you better settle down. You've got a long time to wait. We try to explain to them the situation, but when people are in pain or nauseated or they're worried, they don't want to hear all of our excuses. They just want to see a doctor. So that's just how the brain works in crisis. But when they actually attack us and say, either, I bet if I were white, I'd be taken back sooner. I'm like, whoa, wait a minute. Don't pull the race card here. You've got no reason to assume that there's any kind of racism going on here. And I know for people of color, that's their experience. They do get discriminated against. And so when things don't go their way, that's one of the things that they consider. Are things not going in my way because of the color of my skin? I can assure you that I've never been in a hospital. I've never worked with any of the doctors, nurses, any professionals that treated people differently based on their skin color. Or they attack us personally. And it's like, well, how do you know that I'm not sick enough to go back? And I'm like, read my badge. That's what I do for a living. It's what I've been doing for a number of years. I know what I'm talking about. Please have a seat, and we'll get to you as soon as we can, I promise. And of course, then there are the psych patients who, because of their mental illness, are not interacting in a normal way, and they yell and scream at us and call us names. I've been called every name in the book, and that's okay. Although it doesn't hurt, like it doesn't hurt my feelings, but it just kind of wears on you. You know what I mean? A close second, though, to that being the worst thing is unsupportive management, and I'll do a video on that, I think, coming up. But when I say I need more help in a room, I need more help in a room. And when my charge nurse or nurse manager says, are you sure? Are they really that sick? I've got a lot of nurses doing other things. I really don't have a float to send you right now. Look, when I say it's an emergency, it's an emergency. I know what I'm doing. You're questioning my judgment. And that's frustrating. If they really can't help, that's one thing. But, or if I have an issue that I have to take to a nurse manager about something going on and they just dismiss it out of hand. I did get in trouble once for, well, I'll save that story for another blog. Overall, I would say the best thing about being a nurse is coming home tired, but knowing that you helped someone. Every day I came home from work, I was usually very tired, but I thought, you know what? I think I helped somebody today. So it was a good day. All right. Well, another question. Is it helpful to be a CNA before or during nursing school? I think so, yeah. It teaches you about the healthcare system. You get to see the inside of a hospital. When I was coming to nursing, I didn't have any hospital experience. I had really never been in a hospital except getting stitches in the ER. So being a nurse technician, which is like a nurse aide, I got to see the inside of the hospital. I got to interact with patients. I got to see what nurses do, how nurses interact with each other. what patients need from us. I learned that some of them are miserable and grumpy, and most of them are very happy that someone is helping them, and very kind, even though they're uncomfortable. I also worked, before that, I worked as a transporter in the hospital. So if someone on the floor needs to go down for an x-ray, they say, let's call transport. Yeah, patient in room, whatever, needs to go to x-ray. And I would come up with my little wheelchair. Hi, Mrs. So-and-so, please get in. And we'll take you down to x-ray. And when you're done, we'll bring you back up. Or pushing stretchers of patients going throughout the hospital. And it's a really good way to see how the hospital is laid out and familiarize yourself with the different departments and the different floors, the different services within the hospital. I think that was very helpful when I was in nursing school. So yes, if you can get a job in a hospital in some capacity, I wouldn't say food service because you're kind of tucked away in the kitchen, but anywhere you get to interact with patients, CNA, transporter, anything like that, an assistant anywhere, or a volunteer, it's a good way to absorb this whole culture of what we call the hospital. What advice do you have for nursing students? I have so much advice for nursing students. But let's just pick a couple of the big ones. I would say develop good study skills and good study habits, and including time management. If you're a younger nursing student right out of high school, you're in college, you want that college experience. I get that. I had it. I miss it. I love it. I loved it. But make sure you keep yourself to a schedule. Go have fun with your friends, play intramural sports, whatever it is that you do, play in the band. But then your time to study is also blocked off so that you know this is my time to study. And make sure you get enough sleep, and that's part of it as well. Study hard, learn what you can. On the general education courses, I thought, I'm never going to have to know this for anything, those kinds of courses. On those, you can kind of get by. Most of the time, though, even like history and literature, it just makes you a better person. It makes you able to relate to the world better. So pay attention, but don't sweat those. But when it comes to your nursing classes and your anatomy, physiology, microbiology courses, that stuff you're going to have to know the rest of your career. So make it your job to learn that. And please use all the resources that you have available to you. You've got the library. You've got research librarians who'd be happy to do research with you. If you think, I got to write a paper and find all these articles, use the research librarian to help you, point you in the right direction. They won't do it for you, but they're a big help. And especially faculty office hours. Faculty all have office hours throughout the week. And that's when their door is open and you can come in and say, hey, can you explain this concept to me? I'm not quite getting it. Or, I'm feeling a little nervous about, this exam coming up. Or, I'm really curious about what happened in a clinical recently. And just use them. They're there to teach you and mentor you. You'll have good ones and bad ones, but pick the good ones and go see them during office hours. All right, I just graduated nursing school and I'm nervous about being responsible for another human being's life. Any advice? Yeah, that's a big one, and I've been there. Well, you're right to take this responsibility seriously. People are trusting you with their health and their lives. It is something to be taken seriously. That said, to be honest, it's really hard to kill somebody. It can be done, but you really have to screw up. It's not just like you see on some comedy on TV where someone steps on the person's oxygen tube and they start, there are drugs that we give, especially the IV push medications, that are they take effect immediately. You can easily overdose a patient. So those need to be taken seriously. The system is in place so that mistakes don't happen. So when you hear about a nurse gave a wrong drug to a patient, or some huge mistake was made at a hospital, it wasn't one person. There's probably a chain of events leading up to that. So the doctor orders the medication. It used to be the secretary would enter that into the computer. Now it's directly entered. Then the pharmacist would review it, and the pharmacist would prepare it and then send it down to label it and send it down to the floor. And then the nurse would take it and review it and look at it and then give it to the patient. So a mistake at any of those points along the way could create, an adverse event, as they call it. Try to do your part of the job well. I've made mistakes, certainly, and some of them were just dumb. Some of them are because I wasn't following the protocol. One of them, we're supposed to scan the patient and then scan the drug, and it's supposed to match it up with the order, and then we can go ahead and give it. And had I done that, it may have told me that I had the wrong dose in my hand. Nobody was hurt. I've never given a drug that's actually hurt somebody. But it's embarrassing because we pride ourselves on doing a good job. And of course, when you do it, you have to tell the doctor, and that can be kind of embarrassing. Although most of the doctors, all of the doctors that I've told, none of them have yelled at me and said, "You stupid nurse," or whatever. They've said, "Oh, okay, well, and what do we? It's now. What do we do now? Well, we'll talk to the patient and we'll give an antidote if we need to, or we'll change our plan a little bit or something." So pay attention, be conscientious, but you're probably not going to kill anybody unless you're stupid enough to take potassium, draw it up in a syringe, which they don't even have potassium in little bottles anymore, and then IV push it into a patient. That will stop their heart. But because of this whole process now, they don't even make, or they don't even carry little vials of potassium anymore. They're in the lab, or they're in the pharmacy. They're used to mix drips, but a nurse never gets his or her hand on a vial of potassium to draw up and inject, because it will stop your heart. So worry about it, but not too much. When I was a nurse, and so when I was a nursing student, I have a note to myself. When I was a nursing student, the nurses that I interacted with, they always stressed two things. I mean, they're important, but it was odd that it was these two things. One was only mix the phenytoin, the dilantin, in normal saline. So if you're preparing a drip, sometimes nurses still do this. Pharmacists will prepare it for you, but sometimes nurses do this. You draw up the drug and then inject it into a bag, and label it, and that's your drip of a medication, a constant infusion of a medication. And the one phenytoin, or called dilantin, is for seizures. And if you don't mix it with, if you mix it with anything but normal saline, it can precipitate out. It can start to crystallize, which is not good for the patient. First of all, the drug's not available to them. It's not bioavailable. So I don't know why, but the nurses always stress it. And of course, they always did stress you never give potassium IV push. And that was back in the day when that was actually possible, because there were vials of potassium that we would use to mix up bags. And if you didn't know, you could make a really, really tragic mistake. And if you look, well, this is another question coming up, but about losing their license. Nurses, real nurses in the work world, they don't worry so much about killing a patient, but they do talk a lot and they think a lot about losing their license, which is a big deal, right? Because that's your livelihood and it's hopefully your passion and it's what you're good at. It's also really hard to lose your nursing license. Again, it can be done. You've got to really do something dumb. You have to abuse a patient. You have to do something reckless or be convicted of a really serious crime outside the hospital that will that would lead the Board of Registered Nursing, the Board of Nursing in your state, to yank your license. And more often than that, they will offer to you're offered the opportunity to surrender your license. So it can't be said you had your license revoked, but you surrendered your license during that investigation. It's hard to do. You have to do something really, really bad. So don't do anything really, really bad. Okay, trigger warning, a bad graphic is going to come up here. Well, it's not that bad. Well, yeah, it probably is. How can you stand the sight of blood? Get that all the time. And I guess it's natural that we have an aversion to blood, because biologically, as animals, we see bleeding and it means we've been injured. So it's a bad thing and we should be anxious about it. And a lot of people are disgusted by blood or needles or any number of things. But blood is life. It's all on how you look at it, right? If you see someone bleeding on the street, it's gross. When you're in the hospital and they're bleeding in your bed, you're not thinking, "Oh my God, that's so gross." You're thinking, "Wow, that I need to get a bandage on that. I need to put some pressure on the bleeding. I need to notify the doctor. They're probably going to need an IV. I need some help. Let me call my." You've got a million things going through your head. So blood is, and it's fascinating. It carries so much information. All the little enzymes and chemicals in your blood. When we do a blood test, there's so much that can tell us, and they're discovering new ones all the time. Since I started nursing, They've discovered a blood test that will tell you if you have prostate enlargement. They've developed better tests for heart attacks. Um, they have developed a blood test that will tell us if you have congestive heart failure. It's just amazing you can do blood tests and see this. So blood is information. Blood is life. It also cues me, hey, something's wrong. I need to go address this bleeding. If they're bleeding out of their butt or they're bleeding, or throwing up blood or something, it's like, okay, well, we have to look at, stopping the bleeding and what are their coags and, do they need a transfusion and what's their H&H? So that's the mindset we're in healthcare, is not, ew, that's so gross. And let me just tell you, there are grosser things in the hospital and in nursing than blood. I'll just leave it at that. You can use your imagination. So basically what do? You just do what you have to do and, hold your breath if you have to. You don't get used to the really stinky stuff. You don't. You just have to put on a mask and hold your breath. Another how can you stand question. How can you stand to see people suffer and die? I don't stand seeing people suffer. I want people not to suffer. I do what I can so that they don't suffer. And if that means giving medication for pain or nausea, then I do that. If there's nothing we can do or it's not really working that well, there's always other comfort measures. You make them comfortable in the bed. You talk to them. You try to allay their fears. You try to calm them down and reassure them. All of that. My whole job is about making people not suffer. But sometimes it happens, and sometimes there's nothing we can do about it. And as far as people dying, yeah, that's not happy, especially when it's someone who's young. And whenever someone dies, 99.99999% of the time, there's someone there who is sad that they have died. And so, we naturally are empathetic, right? When you see someone in pain, we start to feel pain. When it's actually been shown, we have what's called mirror neurons, so that when we see somebody else do something, we have a very strong tendency to mirror them. So if you're listening to me now and you're, talking with your hands, or if you see someone and they fold their arms as they talk to you, you watch, and people will, do the same thing. They mirror. And when people are grieving, we can mirror that too, and we can sense their loss and their pain. Here's what I've learned after all of these years in the emergency department, though, that if you are going to be a nurse, especially in an ER, and last for more than like a week, you have to have a deeply held belief that death is a natural part of life. It can't just be lip service. We can all go around saying death is just a part of life, but you have to really be convinced and have a deep conviction that death is a part of life. It just is. And you also have to have an understanding that bad things happen all the time. Now, you can work in an office if you want, or like a lot of my fraternity brothers are band directors and choir directors in a school someplace, doing their job, doing what they love. You're working in an office, you're working as a whatever, and maybe you don't see all the bad stuff that happens. In the ER, we are exposed to the bad stuff that happens. People get stabbed, they bring them to us. People have heart attacks, they bring them to us. People are abused by their partner, they bring them to us. A child is abused or falls into the pool and drowns, they bring them to us. It happens all the time, but this job is where you're going to see it. And you just have to accept that things happen, accidents happen, people are evil to each other sometimes, and there's nothing we can do about it. That's the way of the world. Our job is to do what we can after the injury has taken place. And bad things happen to good people, and that life is not fair. It just is. And sometimes it can hit us. We're not robots. It does hit us that there's a lot of evil in the world, but that's important for us to nurture ourselves as nurses and expose ourselves to the good things. So good times with family, and celebrating birthdays with friends, and the birth of a new baby with friends, and maybe volunteering to do something good. So we see people doing good for other people to balance out some of the man's inhumanity toward man that we're sometimes exposed to. When someone comes in, as far as dying goes, when someone comes in full arrest and they're doing CPR and we're pushing drugs and trying to revive them, here's what I know as the emergency nurse. If we do nothing, they will certainly die. us doing what we need to do gives them their best chance at survival. And if they still die, at least I know we did everything we could to give them that chance. Um, yeah, I mean, we're, and sometimes we're successful. Sometimes we, snatch people from the jaws of death. It's usually not very dramatic, and it's never one person. If you ever hear someone say, I saved a life, unless you were on a deserted island and you did CPR and somebody, it's a team effort. I can think, have I saved a life in my career? Yeah, with the help of other people, I'm sure we have saved, many lives. But I myself alone, no, not really. Um, and then, of course, when someone dies, your job's not over. Okay? There's post-mortem care. You need to wash the body and remove the IVs, and get them all, put the toe tag on, put them in the body bag, make sure they get to the morgue. You fill out the paperwork about, there's paperwork to be filled out, contact the family, and there's the family to care for. Now your patient is the family. Your patients are the family. And letting them know what to expect. And that's a whole skill in itself, dealing with grieving people. And it can be difficult, but I've always found it very rewarding, to be honest with you. Alrighty. Okay. Should nurses be required to get the coronavirus vaccine? This has been in the news. This is controversial. I'm sure everyone has an opinion. And everyone has an opinion, and they're like armpits. Everyone has one and they all stink. Well, no, that's not what it is. Opinions are like armpits. Everyone has one and they all stink. Everyone has two, actually. So anyway, here's my opinion for what it's worth. Yes, I think nurses and other healthcare workers doing direct patient care should be required to be vaccinated against coronavirus. And here's why. Other vaccines are required, and you work in a hospital. When you first get hired, you have to have your hepatitis A vaccination, hepatitis B vaccination. You have to get your annual flu vaccination. You have to show that you had your MMR, measles, mumps, rubella, or a negative titer. Chickenpox, either the shot or a negative titer. That's been going on for years, and no one's ever batted an eye at it. Now we have a new disease coming along, and they say, yeah, we should all be vaccinated against that too. And people are like, you can't tell me what to do. How is that different than all the other vaccines that you're required to have for your job? Our idea is to help people get healthier. And if we're going to bring disease into the hospital, that's the exact opposite. Okay? So it's for the safety of the patients. It just makes sense. If you're in healthcare, you're there to make people healthier. And nobody wants to give a patient any kind of infection or cause any kind of problem. So yeah. And by the way, it's been tested just the way any other drug has been tested, any other immunization's been tested. And now millions and billions of people have taken these, and we know what the side effects are. We know that they're rare and they're usually mild. So your risk for coronavirus and COVID is higher than your risk for any kind of problem, vastly more higher risk for COVID and the complications than any complications from a vaccine. So if you're thinking about it, I'm not going to preach at you and try to convince you, but that is the fact. Believe me, don't believe me, I don't know. But if you work in healthcare, you have a responsibility to your patients, and it's not a big ask. We do it all the time. Second of all, nurses especially are supposed to be committed to science. We are in nursing school now more than ever. It's drilled into our heads, evidence-based practice. Why do we do what we do? Should we turn a patient every 2 hours so they don't get bed sores? That's the tradition. What does the literature say? Well, we go and there's been a study done that we did these patients and these patients and these, and this is what it showed. Okay, we know that it is the best thing to do. In fact, maybe it's better to turn them every hour. I'm just making that up. I'm not sure what the current recommendation is on turning patients in bed. But we don't do things because it's the way we've always done them. We do them because there is science to back it up. And so, nurses that reject science it's a contradiction in terms. And it's about patient safety, as I mentioned. And I think some of these nurses that are resisting, and even doctors that are resisting, they're missing the same point that a lot of the people in the general public who are resistant to the vaccine are missing. Because I hear a lot of, well, I have a strong immune system. I hardly ever get sick. I'm young and healthy, or I don't want to get my kids vaccinated. They're healthy. Look at them. They play football. They play soccer. We're not really worried about it. If we get it, then um, it should be mild and no problem. And if they go to the hospital, of course, that would be worse. But we have insurance. Okay, you're missing the whole point. It's not all about you. You get vaccinated for yourself, but you also get vaccinated to protect the people that you come in contact with. And no, maybe you won't give it to somebody who's immunocompromised who then develops a bad disease and dies from it. But maybe you give it to someone at work who gives it to their kid, who gives it to their grandma who dies because of it. Do you really want to be part of that chain of death? Do you want any part of that? I don't think most of us do. But for some reason, people are, too many people, not people in general, but too many people have this, look, it's up to everybody to just protect themselves. I'm not responsible for anybody in my society, and I'm responsible for me and mine. Take care of myself. You take care of you. And that's why we haven't beaten this virus as quickly as we could have. If everyone had taken responsibility for each other and gotten vaccinated early, worn the masks, just stayed at home for the time that we needed to, the virus would have been under control by now. So let's remember, nurses, healthcare workers, and everybody, it's not all about you. We're all in this together. We really are. I hate hearing that over and over, but it's really true. This is a good question. The next one is not for nurses, but generally for the general public. What are some things people should know about going to the hospital? So if you need to be a patient in the hospital, nobody wants to go to the hospital, I don't think. It's for a lot of people, it's unfamiliar and you don't really always know what's going on. But I would say rest assured that there are really smart and caring people taking care of you. There's some bad apples in the bunch, true. But by and large, people I've met in all the hospitals I've worked at, I worked as a traveler at different parts of the country. I've been exposed to a lot of different emergency departments, a lot of different doctors, nurses, and everyone else. By and large, these are smart people. They know what they're doing and they care. They want to do a good job. They want you to feel better. They want to feel like they've made a difference in the world. These are people who are there for the right reasons. So I hope that puts your mind at ease a little bit. I'd say also, don't be afraid to ask what's going on or when something will happen. If they say, well, all right, we're going to take you down and do a procedure today, I think it's a good idea to ask, well, when exactly will that happen? Or, do we know roughly when that's going to happen? Or what's going on now? I've been sitting in this room for a while in the emergency department. What are we waiting? What's going on? And the nurse, the doctor can tell you, well, we're still waiting for this last lab result to come back. And you know what? It has been a while. Let me call the lab and see if there's been a wire crossed somewhere. It's okay to ask what's going on. Please don't hassle your nurses about things taking too long. But it's okay. It's absolutely, you're right, and good for you to stay informed about what's going on. If someone comes into your room in scrubs, starts talking to you, if they haven't introduced themselves, it's all right to ask, who are you? I had to do that at a doctor's visit recently. Someone came in and they said, hi, how are you? Let's do this. And I'm like, hi, who are you? And they're like, oh, I'm so-and-so, I'm a tech. It's like, okay, good to know, because you can't tell by a uniform what job people have. You'll notice the badges nowadays are a little easier to read, and some of them even have a big section that'll say doctor or registered nurse or technician or something on there, because we want patients to know who they're interacting with. If you don't understand something, always ask for clarification. If you can, bring a friend or a family member with you, especially if you're very uncomfortable and you can't always absorb the information that you'll be given. When the doctor or nurse tells you something, write it down, keep notes. Or if you can't, have your friend or family do the same thing. Kind of keep your own medical record, kind of an informal record. And I've seen some people take this to the extreme, and I guess it makes sense, especially parents of children with really chronic diseases. They have a notebook and they're writing everything down. We came in on this day, the doctor told us this, the test results came back this, they ordered this scan, they decided to give this medication, and they just kind of keep it all for their own reference. You do have access to your own medical records, by the way. If you ever want to see your chart, you can go to contact medical records at the hospital or the doctor's office, and by law, they have to make you a copy of that. You'll sign a release form, but then they have to get you a copy of that. That's part of HIPAA. I believe that's part of HIPAA. All righty. Let's see. Last question. What do you want written on your tombstone? Well, I'm one of those people that actually thinks about death. And I don't know, maybe it's a nurse thing or maybe it's just me, but you kind of think about your life and what it's going to mean and what the end is going to look like and what's going to happen after you're gone, who's going to remember you and for what. And so this is a question I've actually thought about. Um, Here's what I have to say. Everyone has their own beliefs and philosophy about life and why we're here. For me, I believe that we only get one go around. What's important to me is that we only have one go around on this planet, and we have to. Uh, I know she's a distraction. That's Dottie. You'll be seeing her in later videos. She's my older dog. Her nephew is my younger dog, Zach. She's lovely. She's getting a drink of water. I don't want to talk and pretend I didn't see her because I know you see her. So back to what you want on your tombstone. I believe in life because we only have one go around. We have to do it now. There's no redoing it. So my goal is to experience as much as I can. That doesn't mean trying everything in the world, but it means trying the things I want to try. I've tried flying a plane. I took some pilot lessons. I've tried writing music. I've tried playing music. I still do that. I have no desire to go skiing, for example. I could die without ever going snow skiing or water skiing, and I'm fine. But if that's something that you want to experience in life, you should do it if you can. And also, I believe it's important for me to be an asset to society. I want to give more than I take. That's one of my values. The other little fact about my life that really determines the answer to this question is when I was growing up, the teachers wrote the same thing in my report card every year. All the teachers, every grade going up. Scott is not working to his full potential. It was like the mantra of my childhood. And so they recognized I was a smart kid. But I wasn't getting straight A's. And I was a bit of a behavior problem. I probably had some ADD or something. I was learning, but I got bored and restless, and I interrupted class, and didn't always put my full effort into my schoolwork. I'm like, this homework is dumb. I'm not doing it, even though I fully understood it. So that was the mantra. I'm not living out. So I want on my tombstone. He lived up to his potential. I think that would be an appropriate epitaph. So thanks for spending this time with me. Consider subscribing to this channel if you haven't already so you don't miss an episode. Thanks for joining me today, and I look forward to seeing you next time. Bye for now.